I'll call the Friday, October 2nd special meeting to order. First item on the agenda is City of Hayes face mask requirement extension. Kind of lay out the ground rules a little bit. Commission, I guess it's up to all of you. And I have no problem if people are here if they want to speak. We have 3 minutes, I believe, embedded in there again. So, but like I said before, and I think we've done a good job, let's please show respect to the people in the audience. Thank you guys for being here, and please show respect for the meeting. As before, if there is a motion made, nothing is final until there's a vote. So, you may disagree with it. It doesn't mean just because there's a motion. Mask reduce the transmission of the virus. This reduction of spread lowers the number of individuals that could become infected by the virus. We also have witnessed this protection at our hospital. We care for COVID patients daily and have not had any employees contract the virus while at work. COVID cases continue to increase in our community. There is an increase in hospitalizations and deaths of Ellis County residents. COVID infections can cause significant morbidity. Thank you. In patients, including requiring oxygen at home, chronic shortness of breath, viral-related clots in arteries and lungs due to virus, and many other long-term negative effects from the virus. These complications cause individuals difficulty in returning to work and loss of wages. We support the mask ordinance to continue until cases begin to decline and hospitalizations improve. Even a modest reduction in transmissions would significantly outweigh the possibility of harm. Reduced outward transmission and reduced contamination of the environment are the major proposed mechanisms of the mask use. Combined with social distancing, good hand hygiene, we continue to help keep the citizens of Ellis County safer. We hope that you share our goals and missions to improve our citizens. Signed by Dr. Heather Harris, Anthony Caruso, Roger Dietz, Ernest Lopez Corona, Michelle Pope, Ross Buckles, Chelsea Powell, Sherry Claude, Cody Heston, Richard Rajeski, Steve Waring, and Andrea Sandoval. So for me, right there, that means a lot while we're here. But how would you guys like to handle this? You want people here in the audience to talk first again? Or it doesn't matter to me, guys. They're here. I think we should give them an opportunity.
Absolutely.
Okay. So basically, first come, first serve, guys. If you guys would start the 3 minutes, please state your name for the record. So if you want to speak, please come to the mic up here. Thank you.
My name's Tony Taylor. I own On the Rocks Bar and Grill. I'm not really here to say I'm against the mask mandate. I will say that our sales since the mask mandate are down 40%. That includes the Golden Q, and that includes Sip and Spin. Speaking with Eric Schutte, the owner there, and Danny Herman before he relinquished ownership at the Q. What I'm here to actually ask is that Sean Musel recused himself from the vote because he is basically a competitor who received more financial aid than we did from the county. We were unaware of it. He's going to argue the point that everybody knew about it, but only 50 businesses applied for it. How many businesses are in Hayes? Hundreds? Free money. People would have applied for it if they would have knew about it. So that's all I'm asking.
Seems like a personal vendetta between business owners. That CARES Act was open for a long time.
If you're going to, guys, excuse me, if you're going to speak, please go to the microphone and state your name.
Go ahead. I'll answer you.
Go ahead.
A personal vendetta? No, it's a business. It's it's common sense. I mean, if there's a judge that's involved in another case with a family member, he recuses himself. As a competitor,
how does that compete?
He's
with
ruling
the mask
against
order,
us because he's keeping us down, our occupancy down. So his business might be, increasing in sales because more people are spread around. We have higher
sales tax across the city is up significantly.
At the restaurants.
As a whole.
Okay.
Restaurants compete against each other. They compete against the grocery stores. You can't pick out one industry or one business versus everything else. When we can show that across the city.
There's what now?
4 state is now there's 4,000 more people buying stuff.
Sure.
More than one input
Well, there's also more than one input than one business owner attacking another.
Sure,
business
but I'd really take offense that you're saying it's a personal vendetta. I mean, where do you get that? Is you guys talking behind closed doors about our meetings or our talking? I mean, what? It's not personal. I'm just asking him to recuse himself on a professional basis.
I will say I will not recuse myself because that was open to everyone. And actually, one of my neighbors encouraged me to apply for it. You know, I'd read it in Hayes Post. I don't know how many times. I don't have their data, but how many times it was in Hayes Post. I know people said they see it in the newspaper. I don't get the paper, so I don't know that. But I know it was open to anyone, and it
The
wasn't
three
just-
largest bar owners in town didn't know about it. How about that?
Were they excluded somehow by not knowing?
Well, there was another argument that he should have got an email from the Chamber of Commerce, and we never received an
Are you
email.
members of the chamber?
Not from. No, we're not. And so that would
Okay.
be one reason why. But
So how many avenues were there to find out about it?
you said Hayes Post in the newspaper.
That's what I know of. I don't know.
How many other were there, Michael?
I think it was on the radio as well, on a couple different
I don't know,
stations.
every nonprofit that, my wife works for a nonprofit, it was scattered all over their media.
Okay, so minus somebody reading the newspaper on a daily basis, logging into Hayes Post on a daily basis, or listening to the local radio, how else were they going to find out about it?
What is your suggestion, sir, that they should, how should they
That's
have
not the
notified
point. I'm
you?
asking him just to recuse himself. He's arguing that he didn't because of that.
Technically, I haven't got it. We were approved, but I have not got it. Yes,
That's
I
all
did
I'm asking,
apply.
is just to recuse himself. That's it.
And to be clear, there was another grant, I don't know what it was called, that we applied for, and we were turned down because we did not lose enough, according to their guidelines. So we did apply. I mean, there's been many grants out there for many business owners, and, I think everybody should apply when they're out there, but I'm sorry that I did apply for it, but I think anybody would. So. Anybody else would like to talk? Go ahead, sir. Just state your name for the record, please.
Hi, I'm Casey Herman. Sorry, this is going to be a little kludgy. I'm not a public speaker. I didn't have much time to. Casey Herman.
Thank you for being
Not public speaker, not much time to prepare, but here I am. So, kind of preparation of this, I looked at the agenda and everything, and I see it said best interest of the community. So that's kind of what I focus on. Is this is the best interest of the community? Well, we put my aunt in the ground yesterday. She was at a nursing home, 73 years old, had health problems, highest risk. And she got tested for COVID the week before. She died Saturday for liver and kidney failure. And my cousin, her son, he told me yesterday, he hadn't seen her since January. I'm sure that nursing home had her best interest in heart, her best interest in mind. They did everything. They did the mass, they did cleaning. No one saw her. I didn't see her at all this year. I usually see her every reunion because people are busy. And I'm sure they had their best interest in heart, but they did everything. And I just would like you guys to listen to the community. We have a great health department here, Jason Kennedy. They have a mitigation plan. I feel like digging out my phone, digging out a screenshot from Dr. A, spreading fear and saying the hospitals are full. He had to scrub his entire Facebook over the deal. He's on a piece of paper. But I'll never see my aunt again. They had her best interest in mind. These masks, they don't work. You guys can't see it. That's it. I'm out of here.
Sorry for your loss, sir.
Thank you, and sorry for your loss.
Thanks.
My name is Casey Kermer, and I wanted to come up here because I actually want to step out right now. My heart rate has increased by 30 beats per minute. It was 59, and to get here, I rode on the back of a motorcycle, and by sitting there for this long, that's how much my heart rate has increased on my Apple Watch, just so you know that. So it causes severe anxiety for myself. I've emailed you guys several times in regards to the mask mandate that I don't agree with, and one of the things that you comment constantly about is that, and as you can tell, I'm physically bothered by them. And you can ask my husband, he also gets bothered by them too, because then I turn into a different person, my anxiety goes crazy, and I take it out on him. So personally, myself, I have chosen to be one of the people, and I'm sorry for your business, but I do not go into any local businesses here in town. I do not shop anywhere. I personally make that decision to go to grocery pickup. I don't go anywhere that requires a mask because I physically cannot handle wearing one for long periods of time. for us to go in and say you can go into a restaurant wearing a mask and sit down for an hour and eat while not wearing one and then you can leave is okay. But then our children have to sit in school wearing one all day. And if they feel any way that I feel, I personally take that and feel that, because it is not something that you should require on somebody. And then you say, well, the county and the city don't make that mandate. It's done by USD 489. However, USD 489 is going off of your guidance. They cannot relieve their mandate because you are requiring it in this
No, they're-
city.
that's not true.
Not true at all.
And
Not
then
true at all.
how, you have a requirement that in this city, if you are less than 6 feet apart, you have to wear a mask. And if you're in a public setting, that's a public setting. So how does that not go against
If we
it?
take our mandate off, we have information from all the schools in the community that they will not change and they cannot change. They're
That
staying.
you know right now?
Yes, we
I
have
absolutely-
You
information.
don't know
Every
any
one of them.
different if you take it off.
Pardon me?
The other option that you also mentioned was the hospitalization rate.
Mm-hmm.
Northwest Kansas has used one ventilator. We have 98% of our ventilators
That's because
remaining.
of do not resuscitate.
That is current as of KDHE's comments. I'm pulling it off of their site.
Yeah, but for our hospital, again, our doctors have told us.
Your
the reason it's
doctors
not
are
so
also
here
not listing the numbers
is
that
do
you
not
can find on
resuscitate
KDHE's
orders.
page. Our hospital capacity is not at capacity. Anthony Accurso was removed from Facebook and had to take down everything that he was saying because it went against what the hospital was saying. And then
She is
they had to
correct.
come
They are
out.
not at capacity. She is correct on that.
Well, Eddie
They are
Hermans
at half,
has spoken
and
to
they
why
have room
that
to
is.
grow. They have 314 beds currently available according to KDHE's page. So if you want to tell me that we are doing this to protect
Time is up,
people,
ma'am.
it's not. Our cases
you.
aren't increasing
Thank you.
in the hospital.
Casey, there's 11 doctors have signed this besides Dr.
And there's
Purcell.
over 30 that are available.
I don't know anything
That
about what
is several
Accurso
more
said
than
on
just say
Facebook,
something
so.
different, But not a single one will because they fear their job.
Next.
Well, this is way smaller than I thought it was going to be sitting in here. Okay. I'm Kayla Acosta, sorry. Over the last 6 weeks, I've spoken to all but one of you board members numerous times trying to open up more discussion, seek out a plan moving forward. Throughout these conversations, I kept hearing the same thing over and over again. I spoke to so-and-so who's head of this hospital and so-and-so who's in charge of this university and head honcho of this place. Well, talking to these folks in charge may give you another data point. That's not the only conversation you should be having. The real answers come from those who work under those people. I'm sure we've all heard the saying, if you want to know what a man's like, take a good look at how he treats his inferiors, not his equals. I believe this same logic applies to mask information. It might be controversial, but we all know that those in charge have not only more to gain, but more to lose than anyone else in that particular organization. These people aren't hands-on. In fact, they're usually the ones passing down all the rules to the front line to act out. Most are totally unaware of how the real day-to-day operations work. If you really want to know what a business is like or how it's ran, you don't talk to those in charge, you talk to the employees. That's where you'll get your heartfelt answers. That's how you know the motives behind policy, and in this situation, that's how you know the difference in why certain people are pushing for masks when they have so much to gain. I don't stand here claiming to have all the answers, but equally none of you sitting there do either. You all echoed one another saying you didn't know if what you were doing was the right thing. You don't know if masks help, and at the very least, they make people feel better. Those examples alone are prime examples of why you shouldn't be forcing anything on those in the city of Hayes. There is no clear evidence of if masks will help in this situation we're unfortunately in. There is also no clear evidence of wearing these masks may cause harm in itself. Not one of you has been able to tell me what number is low enough, at what point in rising case numbers is there concern. Without these important figures, your plan is lacking. A plan of rescinding is not a plan. Without clear mask data or a plan moving forward, I do not believe you have enough information one way or the other regarding what guidelines are appropriate, and therefore this board should not be forcing anything on those in the city of Hayes. The facts are both sides carry a risk. Both sides have a valid, arguable point. And the only way to represent both sides is to end this ordinance and allow the people to make a choice for themselves and their loved ones. We all make choices every day, and for the most part, I don't think any of us are making choices trying to deliberately sabotage ourselves or those around us. Allow this to be one of our choices. Allow the choice to wear or not wear a mask to be a decision I make for myself and for my family with a licensed medical doctor if needed. While I don't think any of you are making this decision here today lightly, I can support your spirit of the ordinance. I don't believe it's wise to pass this ordinance. It is well within the authority of any private business to require customers to wear a mask, and I would encourage and support such action if they felt it was necessary. But at the end of the day, adherence to federal and state guidelines ultimately comes down to education and personal responsibility, regardless of what ordinance might or might not be in place. There's no easy answer, but there is simple answers. We must have the courage to do what we know is morally right, especially when those answers affect a large body of people. I unequivocally oppose this proposal, and I would encourage all of you to vote to end this mask ordinance. Thank you.
Thank you, Kayla.
Thank you, Kayla.
Next.
My name is Kyle Kermer. And I'm just going to say it takes a lot to get me down to something like this, because I've never come down to this, because I've never had the urge against something that I feel. And what I have talked to in my job, I contact hundreds of people a day. And I know you guys get your input, but I also get the feedback of the people in the community that I talk to on how they do not agree with this ordinance. They think it's stupid. It doesn't work. I want to read you the email I sent you all. It says, according to the Hays City Mask Ordinance, you are required to wear a mask when social distancing isn't acceptable. As you know, there are many churches in this community, which is a public setting. The churches are doing all they can to social distance, but if they cannot, your ordinance requires you to wear a mask. I'm going to read you a statement. Congress shall make no law representing an establishment of religion or prohibiting the free exercise hereof or abridging the freedom of speech or the press or the right of the people peacefully to assemble and petition the government for a redress of grievances. An ordinance, according to Webster Dictionary, is a local law passed by an elected body. The ordinance of Hays is unconstitutional. It violates the First Amendment of the Bill of Rights. I just want to point that out to you guys before you vote to extend the mandate that is unconstitutional. Thank you.
Thank you for coming.
Council, can I ask you to explain to us how it is legal? Mr. Berg, sorry. Thank you, sir. Because I don't want to have an ordinance if it is illegal.
John T. Bird, City Attorney. The ordinance that you passed has also, of course, been looked at by the Attorney General. Part of the issue here is enforcement. The City of Hays does not and has not prohibited any church gatherings, anything like that. We recognize the right of free speech. We recognize the exercise of religion in this community, just like in every other community. And the ordinance is not, in fact, applying to the church gatherings, those kinds of things. As a matter of fact, we've made that clear to all of the people who've asked, and I believe that the chief of police has also had meetings with religious leaders throughout the city to make it clear that that is not how the ordinance applies. So the ordinance, ordinances are interpreted under the Constitution. So we clearly cannot apply that in those contexts. It's just not applicable to those situations. Does that help?
Yeah,
Thank you.
Thank you.
Appreciate it. Anybody else? Sure, real quick, please.
If it does not apply or is enforced in churches, that goes against the ordinance of being a public setting. And it violates how a person practices or their religion when or how by requiring a mask in a public setting. The churches are in the city limits. It is a public setting. If there's going to be no enforcement of it, there should be an exemption of churches then. And then you'd have a gathering of churches and no masks. Yeah.
Respectfully, I'll tell you that's why I went to school, was to understand these distinctions. We don't pass ordinances that then give special treatment to religion either. The constitutional provision that he read to you says we don't pass laws that establish religion, and we don't pass laws that prohibit religion. So we don't pass an ordinance that says that you have to do certain things to be a religion, and we don't pass laws that say you can't do things if you are a religion. So the point we're making here is that our law, if you are exercising your right to religion, does not prohibit you in any way from exercising that right to religion. So respectfully, I'll tell that gentleman that if he disagrees with us, he needs to consult his attorney, because his attorney should tell him, if he went to the same kind of school that the rest of us went to, that this has been litigated and resolved, and the churches have, in fact, been told at their own request that these laws don't prohibit them from meeting. You know, whether they're the church of whatever, and I don't want to single any particular faith out. They get to have their faith, and we don't get to encourage or discourage it. Sir, that's you're not hearing what I'm saying. I don't require you to wear a mask in church. I just said exactly what I said. So you're assuming something that's not true. You're not going to get to win an argument by establishing the rules. I just got done telling you you're not prohibited from going to church, and you're not required to wear a mask. I didn't. This,
Talking about the mask required in church.
Okay, we need to move on.
okay, I think I've answered that question.
Thank you, counsel. Anybody else want to talk? Huck, thanks for being here.
I'm going to claim the 6-foot rule here.
You're fine.
I'm Dr. Holweger, Ron Holweger. I wasn't even going to speak this morning. I just wanted to come and observe the process. But I've heard some extremely elegant arguments this morning. Now, I'd like to take just a little bit different task on this. This is a mask. This is a mask. He's wearing a mask that probably lets all the virus through. I think if you want to have a mask law requirement, then you should have a proper mask. And that's an M95 mask, or I should say N95. The reason for that is, if I wear a mask like this, I don't protect myself, but I protect others. My job is not to protect others. Your job is to protect yourself. An N95 mask will protect you from me, whether I'm wearing a mask or not. So I think until you come to a point where you actually have people wear effective protective equipment, then I think this is all a farce. And that's where I'm going to leave it. Thank you.
Thank you, Dr. Holweger.
Anybody else? You don't need to.
I just want to say,
Please say your name for the record.
Shonda Worth.
Thank you.
I just want to say, I just feel like you are infringing upon everyone's rights in Hays, Kansas. I think that you were elected to be our representative, and I don't feel like that you are representing us if you're not even asking anyone what their opinion is. And I do believe that most people don't want to wear masks. They did a survey at TMP, 80% of the people responded that they didn't want any kind of masks, social distancing, anything. And I think we're just totally disregarding this based on your own thoughts and fake. I don't even know where you're getting it either, because Jason Kennedy is, supposed to be the one that's looking at all of this, and you're not taking anything that he says into account. You're just totally disregarding him. And as far as me wearing masks, I don't go anywhere anymore just because I refuse to wear a mask. I won't go, I've gone 3 times to a sit-down restaurant since March. And that's because my sister-in-laws were here from out of state, was the only reason I went down. I mean, I spent $200 or $300 at Walmart every single week, and I don't anymore. And now Walmart has stopped. Walmart doesn't have a person at the door. They don't have any of their things, you know, their lines, anything. I've heard that from other people at different towns that all of their Walmarts stopped doing it. I just don't understand why we're doing this and tearing our whole entire community apart, because you don't know if anybody, like what anybody thinks. Are they looking at me funny because I'm not wearing a mask? Is she looking at me because I am wearing a mask? You have no idea. I don't know how anybody feels. I don't know how, you just can't gauge anything. But on top of that, my son just came down with a rash all around his face. And I'm so angry that they have to wear masks every single day, all day long in school. And then that even if they're wearing masks, everybody around them, that if somebody gets COVID, everybody around them still has to go quarantine for 2 weeks. I'm like, do the masks work or don't they work? I just don't believe that they work. And I just want to finish with somebody that I know put down the average death rate in the United States in 2017 was 7,708. In 2018, it was 7,778. In 19, it was 7,821. And in 2020, it is 7,588. The death rate is not increasing. I'm very confused and very against the masks. Thank you.
Thank you.
Thank you, Shonda. I want to just a little bit of clarification there. Each time that we've had, and I've talked extensively with Jason Kennedy, each time that he has come to talk to us, he doesn't speak to the mandate, but he has said he supports masks. He went as far to say in my conversations this week that if the resolution is not passed, that he asks us to please, please, please resolve to continue and to support the use in schools. And those were his words.
I watched Jason Kennedy walk out of the last meeting very upset because he feels like he's not getting heard. He's telling you that there is a...
If you want to speak, I'm sorry, you do need to go back up there.
Okay. I'm just saying...
Thank you.
I mean, I've heard him say, we have a timeline of what we're going to do. And when you say we're going to require masks, and he's saying we're in phase 1, you shouldn't require masks until phase 3, because nobody's going to get behind it. And I can see it. I don't know. I feel like when I go places now, less people are wearing masks, people are wearing masks. I think people are just going to get tired of it. I've seen people walk up, in Walmart, and they see somebody else not wearing a mask, and 3 aisles down, they don't have a mask on anymore.
I appreciate that. I was just clarifying what Jason said.
I know that he was very upset.
I don't know
when
why he
left
was angry. I've talked, like I said, talked to him regularly.
I don't know, but I feel like he's being not heard. He flat out, I listened to his whole entire talk. I feel like he's flat out said, this is not the time, and nobody listened to him.
Well, I will tell you, I actually I emailed the county commissioners because I've had a lot of people comment that we're not working together with the county. Jason is an employee of the county, and I asked the county commissioners, would you guys like to meet, together? Maybe we can all be on the same page, because I think that'd be best for our community. And Dean and Butch, pretty clear to me, said no, we have no interest. Our plan's working, and they didn't want to change. And I'm sorry, but I've had many people in the community that's very upset with them, and they don't think they are doing enough, and that's why they're asking us to do something. And we are listening to other people besides doctors.
You are listening to people, but are you listening to the majority? Because I don't think you are.
There is no majority on this issue. There is no majority on this issue.
But like I said, the only person that
If you're going to talk,
You
you've
have
gotta
to go up.
back,
I'm
please.
sorry. That's just the regulation. That's just the way it is.
I'm just saying that the only people that actually did a survey was TMP and Holy Family. And like I said, it was overwhelmingly, it wasn't even close to the amount of people that didn't want masks, social distancing, anything going back into school. And as far as why they're telling you that they still have to wear masks in school. From what I've heard, it's because of the grants. If they don't do what they're supposed
I
to
know anything
do,
about
they don't
that.
get grant money. And so that's why they're continuing the mask.
Why did they, if they had that, and I'm not being argumentative, I promise you I'm not trying to be argumentative. If they had 80% of the people that are associated with their schools say they didn't want it, why did they do it?
Because they said that there was grant money that they couldn't get.
I don't know
if
anything
they-
about that. Sorry, I can't even
I
talk
mean,
to that.
if honestly, if you want to talk to Chad Meitner,
I have.
or
I
they
think-
both have that survey. I
Michael-
have the survey.
Michael, didn't you talk
I have
to,
direct, yeah.
I can show
Maybe
you
you're
the
gonna get to that.
survey and the
No, I won't,
results of
but
it.
No, I have spoken with Chad multiple
But it
times.
did come out. If you
Yes,
read-
I have, I know, I understand the survey, but that's a very, that's not a scientific survey, that's just a,
It's not, it's a- I'm
but that's
saying
just
it's a
asking
survey
parents
of
what they
the
want,
people
but as far as,
of Hayes, Kansas that you're
Okay.
representing.
all right, let's move on.
and that's why I've reached out and talked to them and others, that's, to say that we haven't talked to a majority of people, that's,
All right, is there anybody else that hasn't spoke, like to speak? Else out in the hallway or anything, or, I'm sorry, go ahead.
My name is Comas Kramer. I was here at the last meeting. Some of you remember me or not, but I'm not going to get kicked out this time. We actually had really good meetings with the
Promise
commissioners.
that won't happen.
Over this last week. We didn't get to meet with Ron, unfortunately. I did message him. He messaged me back. I'd like to know a little bit more about him. I feel like the meetings were very good. I think that there was a lot of animosity before, and it's hard to look at other sides when that's there. I was able to understand why you voted a certain way, which was not the way many of us in this room feel, but I did understand. I went there for a minute, and I understand. But overall, I don't have to say anything that everyone else said because that was part of what I wanted to say, so now I get to have a little bit more time. We know, and I know when we all met, just like the doctor standing up here, I'm sorry, I forgot your name, doctor, but you standing up here, we know that these masks are not very effective, if effective at all. And then the N95 is obviously the better choice if that's the way we're going to go. But we also realize that masks are not working. Places that don't have masks, places that are having masks, it's just not, we're not able to control this. But listening to people up above and in our community, I understand why you would do that. I also understand when Kayla said their main priority and their main job is not always, it can be more, they need to keep that money driven in and out of our economy, and that's good for our economy here in Hayes, definitely. My suggestion would be to take the ordinance off right now, to have a level where you say, okay, right now we have a lot of cases. We have cases each week, right? We do. They're coming, sometimes they're higher, sometimes they're lower. We need to be monitoring the people that are in the hospital, and that's why you're talking to people in the hospital. It's not at capacity, which we obviously don't want it to get there, but we're also infringing on people on the other side that are anti-mask, looking at them saying, I'm healthy, I'm not fearful. I don't say I want to get it, that sounds bad, but I would rather have immunity to it now and start to build my immunity up for this type of virus than to have to get a vaccination later or it be mandated and that end up where it's being. And that's where a lot of people are fearful of this going. And to not address that, I know at times it sounds kind of political. When I talked to Sandy, it was political in your eyes, didn't want to address it. But we have to address that there are people that are fearful of their freedoms being taken away. And the masks are not 100%. We even said, well, it might offer a little bit of protection. I agreed. It might offer a little. But what happens when you get sick? You get sick, and you're having this mask on your face. What happens then? Who protects you then? We need to think about all this stuff. We need to think about it. I totally can see taking the ordinance off, and if things get too bad and we have to control this, say, you know what, or even shutting places down if we have to. But letting people feel their freedoms, letting them know that this is not the end all. We know this is not the end all. We know this is not helping us the way that we wished it would. Staying home would be. So if those people that are fearful want to go and stay at home and do school from home and do things, we know being away from people that have the virus, that's going to help us. That's going to keep us safe. Let us be free of these, please.
Thank you.
Thank you, Comas.
Anybody else in the hallway? No. Okay, commissioners. Anybody have anything you want to add to that?
I don't know how we want to have the discussion. I guess I will move that we resolve to extend it, but for the sake of discussion. I'm not putting any restrictions on yet until there's a discussion. John, I'm looking at you.
Under the ordinance, you have the option to extend it, or you can terminate it early, although right now it's terminating on its own if you do nothing. If you want to extend it, you do have to put in either a specific date or a specific event or something objective. And so as you discuss this, you might want to consider putting in some type of, I hate to use the word metric, but something specific that doesn't have to be revisited, either a date or something that can be objectively
Do I need to put that
ascertained.
in my motion for
You
to
should.
discussion?
You should ultimately, yes.
I'm just going to put, Toby?
I just want to make sure that John's answering the question that I think you may be asking. I think you're asking more of a procedure question.
I am.
As less of a content question. Typical commission procedure is there's a motion on the table and a second before you hold discussion, but that's in a typical meeting where you're presented with something. You're presented with an item with an action requested. In this case, you're not. So I think, and John can tell me differently, I think you can talk amongst yourselves about what you think may or may not, should or should not be in the resolution, and then somebody can make a motion.
Before the motion, okay.
Right.
Exactly.
No,
Okay.
Yeah.
okay.
I'm
But
good with that.
I think procedure-wise, I make a motion to close all public comments at this time.
And I'll second that, seeing none in the audience.
Okay. All in favor of the motion, say aye.
Aye.
Aye. Okay. Public. All right, anybody, do you want to start discussion before we do a motion, or how would you guys like to handle this? 'Cause
I'll yield.
Okay.
I'll start this discussion because I am looking at matrix as an idea. I voted the first time to put the order in because I think I do believe, you can sit here and look at the whatever information you want and believe it works or doesn't believe it works. I do believe it works. I did not vote to extend the last time we looked at this order, and that was based on kind of the arbitrariness of picking a date. And I would not vote for an extension at this time either if we go by date. We don't know this virus, whether it's going to peak or subside or abate, when that will be. So the idea of selecting a date and then revisiting it to decide if it's working or not or helping or not doesn't appeal to me. So having reached out to many people and getting feedback, here would be my suggestions as far as an ordinance with a matrix. I would suggest one of two. The 7-day average rate in Ellis County of positive COVID test remains below 10% for 14 consecutive days. Or the 7-day average of new cases of COVID per day in Ellis County remains 5 or fewer for 14 consecutive days. These are numbers coming from Jason Kennedy as a suggestion as well. These are numbers that are actually, for some clarification, are actually double what federal guidelines, CDC, state is looking at. They would suggest 5% or below 2 new cases. I don't think we have to drive it down to those levels, so that's where I think we can be a little bit lenient as far as the levels.
Commissioner, can you repeat your first two options? I'm just trying to
But I
absorb it.
want to ask a question before he does.
Okay.
Looking at the 10%, I think Jason referred to that for the percent of positives under 10%.
Correct.
And
So
then the other one
rate of
being
positive.
5 cases per day for at least 14
On
days.
average, yes.
Yeah.
The
Okay.
10% of positive, is that
So
the
there is a
7-day average?
caveat, so to explain the 10% positive and I will say this, Jason Kennedy said he would prefer the 5 cases or below because the 10%, while I'm a percentages person, I like that. The idea of percent of positive means we need to have more people asymptomatic to test. So that way that percent positive comes down. If only people that come up positive with COVID are tested and they all come up positive, your percent of positive is 100%.
Of
Right.
course.
So to drive that below 10%, you need asymptomatic people too. And so that number is kind of fluid on some outside, if people get tested or these kind of things. That is the metrics that I personally kind of like, though. I do. I understand percentages better. But the other one, again, and I'm not suggesting both. I think
One
we
or
should
the other.
pick one or the other.
Or do you know, are people able to get the test if they're not showing symptoms?
I can't.
Quest Diagnostics actually lets you order tests at home now.
Okay.
They'll ship it to you FedEx. You can do the nasal swab and send it right back to them straight
And
to Quest.
that's open to anybody.
Open to anybody. You do not need a doctor's order for that.
Is that cost prohibitive? Do you know?
Most likely, because it's not going to be done through a
That
doctor's
could be
office.
something that
So it could be
Insurance
cost
probably won't
prohibitive. I don't know how much insurance covers.
Sure.
That's the email I got from Quest.
Okay.
Jason did make a comment, and he was really forthcoming with conversation this week. And for everybody here that says we're not listening to him, we really do reach out to him. I personally reach out to him on a regular basis. He said the 10%, he's comfortable with either one, the 10% of positives or lower for 14 days, or a daily case rate under 5 cases per day for at least 14 days. Now, he did say, and I think I'm clear in what he said, the 10%, that percentage of positives, you can find on KDHE very easily. You can go right to it. His, the other number actually comes from him in his office. I don't know if that makes any difference to anybody, but
Part of that's kind of why, again, for me, my thought was the 10% because that's the number. That's the easily accessible that the community, when Hayes Post does their Monday, Wednesday, Friday return, that's kind of the very first thing that. And so to me, it's an easy number to kind of the community can keep an eye on. But again, I understand where if people aren't getting tested negative, positive, then it may not.
Tough to
drive
go down.
And just to point this out for the media, and where we are at currently, we're at 16.7% positive test rate in 11 new average cases. And so both of those metrics, again, Jason's kind of indicated this, they're both easily attainable to where what we're looking at. If we went from 16% down to 10 or from 11 to 5. So it's not really picking which one is harder or easier to get to necessarily.
I just want to make sure I'm clear. So on the 16.7, if we went down to 10 for 14 days,
masks come off.
masks come off. No questions asked.
That's how I see it.
I'd put it. I'd say below. I mean, I'm above
Well, yeah, 10 or below.
9.9%.
Yeah, right.
And to clarify on the 5 as well, because Jason said below 5. To me, that means 4 or less. In mine, I say remains at 5 or so. 5 would be
The number.
Not below 5, because now you're.
And Jason I had thought 7 days, I had thought 30 days. I really didn't know. It was Jason's suggestion that at least 14 days was a reasonable time.
And that's the numbers that they keep putting out is that 14-day roll.
I'm suggesting 14 because that's the quarantine date. I'm flexible. I think it needs to be at least 7, but because that's the average, a 7-day average, so we need to be able to see it maintain itself.
But that 16.7, the previous reporting was like 27 or 31, wasn't it?
We
Am I right?
were well above 30
Yeah, that's what I thought.
a few weeks ago. Which again, from a percentage standpoint, that can make sense. I mean, 30% would mean 3 people went in and 1 person tested positive, and again, it might have been somebody that knew they had symptoms and was ill, going to get tested in their mind already knowing, and then saying, well, I need kind of use Fort Hays as an example, I need to get both my roommates tested right now, and that would come back negative, but that, again, you're only looking at 3 people. They didn't necessarily say, well, I'm ill, so we need to test the whole dorm, right. And if you come back 1 positive and 100 negative, you're only at 1% positive. So that's where that percentage can be very fluid, just depending on how many people.
And I think, is that I mean, is that what Dr. Mason is referring to when she refers to surveillance testing? Is that that same thing?
And I will go into that. I don't remember if that was her or who. Maybe it was Jason Kennedy again. Because he mentioned it, because our hospital and our facilities don't have right now the ability to just test community-wide, which would be fantastic.
Right.
Whereas metro areas, again, being where they are and needing more tests and those kind of things, can certainly test more people. And their governments, their governing bodies can pay to have more tests. You know, again, I don't think we're looking at the city of Hayes of offering to pay for tests. So that number, again, is up to people just going in on their own, really, or requesting it. So I can see where that percentage may remain high just because only people that are feeling symptoms get tested and not asymptomatic people.
So if we
And
hit,
I'm sorry. Well, I just wanted to clarify, it was Mr. Kennedy that he said my only issue with percent positive as the only metric is that it's completely driven by factors that we do not necessarily control. Unless we adopt a large, wide-scale asymptomatic testing plan, our percent of positives will remain high. And we don't have the drive-through testing like they have in the city and all of that. So that's the only, I mean, I like the 10% metric, but I certainly see the argument against the 10% metric.
Yeah, I do. I mean, I like the percent, but I agree if people aren't getting tested or if it's a price, I mean, if people can't afford to do it, they're not going to get tested until they start having symptoms.
Well, and I really like the fact that if we used a metric rather than a date. This virus really pays no attention to dates.
And that was essentially my problem. You know, again, my problem for the last extension was, you know, here we are 30 days later, and I see that chart and I see cases going down, but does that mean we do it another 30 days and we do it again, or we go to the end of the year and where are we at? To me, we have to look at what are we trying to accomplish with the virus and where it's at, and so that's where a metric.
If we hit the metrics laid out, and then the next 14-day period, we're back up again. Are we back here 2 weeks later to enforce the mask again?
No,
John?
I think it's.
I don't think so.
Kind of wait until you got to that point. When you do make your motion, I would recommend that you make it an on-off switch. In other words, that you not get on a roller coaster. And that if the community achieves that metric, whatever you choose, that it's off. And that at that point, if you wanted to reinstate a mask ordinance, you'd have to go through the process again. So that you don't have any doubt in the community.
My gut says if we use a metric, if we meet the goal and it falls off, my gut right now tells me I would not revisit it. So,
Totally in favor.
Never say never, but at this point, I think we try to put ourselves a target out there. Like any good business or athlete, you reach for that target and meet the goal and go on. So.
I like what you laid out. The percentage almost scares me, even though I like the percentage. I think it might be almost unobtainable. Because
in a way, I kind of like the idea of using Jason Kennedy's numbers. If that's what,
I do too. Makes it easier for the
helps us
community as well.
even just a slight bit more people asking us to trust our county commissioner or county health, and if that's the number he thinks he can report to us, and
And we're using the number 5 as we started in the discussion, that's still significantly higher than he's saying most communities have chosen. They
most
usually
communities
say
are
2.
But isn't the CDC, isn't that what they're recommending, is 5 or is it 5%?
I think 2. There's
I think
5%.
2 is the number. They're 5%.
5%.
It's just ridiculous. Yeah, I don't know.
No, yeah. I actually agree on the number 5. I think we could hit that, and I think it could come off quicker.
Roll that over, and I'm gonna add one more. Told you there's multiple. So my other, I would like one of those metrics. The other suggestion I would have in the order would be it would be rescinded. It would not rescinded. It would stay in force until the statewide state of disaster emergency related to COVID-19 mitigation measures are rescinded.
Till the governor takes it off,
Yeah.
basically.
So if we haven't hit
So
the
if she
5
comes
and she
off on the
takes off.
15th, we're done.
Because, and that's it, because the state order right now is set to expire on October 15th. And I don't want to put in something like our metric, and we haven't hit the numbers, but the state order comes off and we're in here,
Yep.
essentially closing. If the state, my assumption would be that the state would probably extend their order anyway, but again, if they rescind it because the state numbers get there before Hayes does, that's fine with me too. So.
And I was going to suggest the same thing had Michael not. So I'm okay. This seems weird to say what I'm okay with before we vote. I'm okay with 5 cases per day for at least 14 days. And if use your whole phrase there, the governor's emergency, whatever, comes off, we come off as well. Can you make that into?
So if she takes it off before we hit 5 days, it's off.
Done, yeah.
So are you guys talking about doing the 5 days or the 10% of positive?
5 days is what I'm
I think
looking
5
at.
days.
I'll go with,
Or the 5 cases per day?
5 cases per day for 4.
The 7-day average of new cases of COVID per day in Ellis County remains 5 or fewer for 14 consecutive days.
And that's on that report that he puts out 3 times a week.
And Michael, since you have everything in front of you, I'd certainly have you go ahead and make the motion if you like. You can read from what you have.
Might need John to, at least, oh, there it is, okay.
Well, anticipating that, what I'll do, when you make your motion, we'll take it from there and actually put that into the motion after the meeting. I mean, in other words, we know what your motion will be after you make it and pass it, and then we'll make sure that the wording is exactly right.
I'd have to sign it, right?
Yeah, you'll all get to do the final approval thing here this afternoon. So
Yeah, gotcha.
okay.
Well, I move to approve resolution number 2020-1017, extending the requirements of ordinance number 3988 of the city of Hays, Kansas, pertaining to requiring the wearing of masks or other face coverings to end based on the criteria we discussed of 5 or fewer cases over 14 consecutive days, or when the statewide disaster emergency relating to COVID rescinds on its own.
I'll second that motion.
Okay, we got a motion and a second on what we all discussed. Any more discussion on that? I think it's pretty clear. I like having the number because I know a lot of people have asked, like, what is our target? And I think maybe shame on us that we didn't put that out first, but to be honest, the numbers have kind of changed. The reporting's changed from what they began, and it seems like it's pretty consistent now, what he's reporting. So,
Well, we're really in uncharted times, and the fact that we didn't do it right the first time, we're not doing it right the second time, and may not do it right the 5th time, we're looking at the same information everybody else is and doing the very best we can for this community.
and I will say for myself, I've got a daughter right now that's in halfway through her 14-day quarantine. She had a mask on around a kid that tested positive. Half her class got quarantined. So far, no symptoms. They had the mask on. They were, but she was within the 6 feet. So we're personally hoping to God that it worked. But it's rocked our world how mom can't go to work right now. And, there's many other people in this community is having the same issue. And for me, that's where this issue lies. I've had small businesses, I would say cohorts, whatever you want to say, across the street from me that say that I'm killing their business. I think our community being unhealthy is killing our business personally. And I haven't taken the hit that the bar owners have by the college, and I have a totally different clientele, and it pains me to hear you say you're down 40%. But I think doing nothing is not the right answer. And I think we're going to be chastised no matter what we do, but I think we're doing the right thing here, guys. I'm going to call for the vote. All in favor of the motion, say aye.
Aye.
Opposed, nay.
Nay.
Passes 3-1. We're adjourned. Thank you all.